So what made you think about PLAB going to United Kingdoms or to go and study abroad? Like how's the stipend or the salary there?
Roughly at our level, you get paid about 40,000 UK pounds yearly. That's like around 40 lakhs yearly. And
Oh wow! How much should be
as
the
you
budget
go,
in the mind? Just for a like an idea.
I think to be safe, having 3 to 4 lakh in your bank account to show it to the visa people, it's
Yeah,
sufficient. It's like I became a doctor just to become a surgeon.
it looks attractive maybe from outside, but
Yeah.
it's not as easy as it is.
The best part about NHS is you can't do 24-hour shift. You're not
Oh, is it like
allowed.
Doctor House, which we see in the web series?
It
Yeah.
happened to me that my consultant was somebody who was of 60, 70, and he was like, do you think this fracture is
Okay.
reduced, or do you have any idea, like, how should we do it? Then, I gave him an opinion, and he did consider it. It's like very nice environment to work in.
Hello everyone. Welcome back to my channel. I am Dr. Nishant, currently pursuing general medicine. Today with me is Dr. Ishmita Paul. She is from West Bengal, India, and she has completed her MBBS in India. And right now she is pursuing her post graduation in United Kingdom. And I'm glad to have you here, Ishmita. I hope you're doing well. And I just got to know that you have cleared your MRCS examination as well. So many congratulations on that. So how's life in UK?
So, firstly, hi everyone. I'm Ishmita, and I'm currently planning to get into my training, surgical training in UK. So, I just did my MRCS part A. I have not completed the entire part, but people say that MRCS part A is almost equivalent to completing the entire MRCS because it's very difficult. Anyway, yeah. So, life in UK is good. I feel this is just what I wanted to do, and this is the kind of job and the work environment that I always wanted to have. There are drawbacks, but everything has pros and cons, like
True.
we say. Like living here has pros and cons, living there has pros and cons, but I feel like pros are in more of my favor than the cons. So yeah, I really enjoy working there, to be honest, and being a part of the NHS did teach me a lot of things that which I didn't know while we were training, while we were in the medical school
Yeah,
and training
in the
in
undergrad.
our
Yeah.
foundation. Yeah, so but yeah, overall it's a very, very nice experience, and that's what I wanted always.
Yeah, that's really nice to hear. So, like Ishmita, starting right away. Almost every aspirant after like undergraduation in India, they go for the Neet PG examinations or the inicet, that is like for the AIIMS or the Central Institute. So, what made you think about PLAB going to United Kingdoms, or what made you take this step to go and study abroad? So, how did it come up?
To be honest, that's a very nice question, and the thing is, it started way back when I was in school. So when I was in school, like I used to see most of my friends and my seniors, they would go abroad for their higher studies. But as you know, pursuing medicine outside India, like in United Kingdom or in US, it's like very, very expensive. And the fact that I already got through a government college, which basically means I won't have to pay anything for my med school.
True.
So because of that is one of the most important reasons why I stayed back for my med school. But when I started my med school, I initially thought of preparing for USMLE, so I bought all the materials and stuff. But
Okay.
later college happened, so I dropped everything. I did not give any exams. So I was thinking that in my first year I bought all the materials, and then I was thinking like from my second year I'll start studying, because usually people say you should give USMLE step 1 like after your
Yeah.
after your second year.
Second year, yeah.
Yeah. So I was thinking that maybe after second year I'll start studying and I'll do the exam, but that never happened because I was enjoying too much in college. So coming to post internship, so during internship I was thinking like, shall I do Neet PG or shall I think of something else? And to be honest, my dad was a very, very great support for me.
Okay.
He always wanted us to go out, and he himself wanted to go abroad, so he always encouraged us to go and do whatever you want to. And but the thing is, because from where I did my MBBS, not many people do USMLE, and to be honest, like I don't have any I don't know any of my senior who did USMLE or
definitely.
PLAB, or we don't have that trend in our college. But this trend is there. If you come to Kolkata or Delhi or even in Guwahati, I think more people in Guwahati do these exams more.
Okay.
But yeah, in Jorhat I did not really know anybody, so I just straight away went for rural and then started preparing for Neet, because everybody says that's the most safer option. And then I started doing my research about PLAB and USMLE, then like digging in
then it
more
happened,
because nobody really knew what PLAB was, because USMLE is way more popular than PLAB. But PLAB, there are like the percentage of people who do PLAB is comparatively lesser, I would say.
So I started to do my digging, and then I found out, like, for me personally, to do PLAB is better than USMLE, and hence I just like went for PLAB. And like, honestly, I wanted to experience the life outside. Then I wanted to travel along with, having a good job, and like being a doctor and
doing
being
the
able to travel, which can happen if I'm working in that country. And also, like, I won't have to give an exam to determine what specialty I'm going to choose. So which in India Neet does, because everybody is not lucky to have very high scores, even though I gave Neet. But and I
it's very high competition, and it's unfair also sometimes because of the reservations and everything.
Also, like, in here, like, an exam determines like what specialty you are going to choose, but whereas in US and UK, you can choose your specialty and apply for it. You need to fulfill criterias, like you need to have a good CV and all of that. But if you are determined, you'll be able to do it. But at least, like, like, these are the three things, or these are the three shortlisted things that I want to do. And or like, even if you have one, like, I want to personally go for surgical training, which is difficult, which is like one of the most difficult to get into in comparison to like IMT and GP training, and but like, so I feel like it's your choice. Like, at the end of the day, you should be able to choose what you want to do. Like, so these were my reasons.
Okay, got it. That's really nice. So let's start from the really very basic. Like, if someone who is watching this wants to know about PLAB and want to go to UK, so what is PLAB first of all? What are the stages? And like, as you said, for surgery and medicine allied, how is the process to choose that? So can you just elaborate a little bit in detail for our viewers?
PLAB is basically a licensing exam. So the medical council of UK is called as General Medical Council, and PLAB basically is the licensing exam, and it comes in two parts, part A and part B. So part A is basically MCQs. I think there are around 300 MCQs, and part B is like a OSCE. So you have around 15 stations, and you need to interact, examine, treat. So those kind of stations are there. So for part A, I would suggest, like, there are a few apps that you can use for studying. Personally, I used something called as Plabable and MedRevision, and also PLAB keynotes. So these were the three things which I used for doing the PLAB 1 exam. And for PLAB 2, I took, you need to go to UK to do the PLAB part 2. And so you have
Okay.
like coaching institutes there who will train you, who will give you all the notes, then train you accordingly. So yeah, there are institutes like Sobi, then Samson's. So those are
Okay.
institutes. I did Samson's and it was okay. Like you can just choose like any of the
Okay. There are good
institutes.
options available. Yeah.
Yeah. One thing I would like to add to this is PLAB is going to get converted to UKMLA, like
Okay.
how, yeah, by 24-25. So
Okay.
for I know like people who are appearing for 2025, they will be giving the UKMLA. I'm not sure about what's happening to people giving in 24. For 24, I know February and May will still have PLAB 1, and then maybe
Okay.
after that they will introduce UKMLA. Yeah, so UKMLA, how is it different? It's just like it's going to be a generalized exam, how USMLE is a generalized exam for the US graduates and the international graduates. So UKMLA is
Yeah.
also going to be the same. So yeah, that's the difference. I don't
All
think
right.
there will be much
That's the
difference in preparation and the exam itself.
Okay. So the regarding the source that's playable and all the like the premium course I think you took, right? And what is the like is it at par with marrow and sources like dams, like the cost and everything, or how it is the thing?
So I think Marrow and Dams also they do some PLAB courses, but I'm
Okay.
not sure like how they
Much.
are
Yeah.
because I have not used them at all. But
Okay.
I think the Plavable, it's like a standardized course. It's like people have been
Okay.
using it like for many, many years. And that's
Okay.
like the basic. I would suggest anybody going for PLAB, that's the basic you should do. And you can add like med revision, which is like a little more difficult.
In depth.
And
Okay. Yeah. Okay.
yeah, and these apps, med revision and Plavable, they are just MCQs, and for notes like you have PLAB keynotes and stuff like that. But if you honestly asked me about dams because I took dams coaching in before
Yeah.
uh, I did my Plavable, so those
Yeah.
knowledge
We entered
definitely
PLAB. Yeah.
definitely helped me. Yeah,
Definitely. Yeah.
definitely helped me.
Okay.
But I cannot say
Okay.
like you can just based on your dams notes you can give these exams
Yeah.
because the question
Got it.
patterns are a little different,
Yeah.
and
Different.
like
Yeah.
yeah, and they have like specific questions which are like very common and they come often in the exam, so it's good to like at least go through a question bank before. And I think it takes around 3 to 4 months of preparation is enough like to do
Okay.
the exam. Yeah,
So generally, when is the PLAB exam? Once in a year, the part one.
it happens 4 times in a year.
Okay.
So, yeah, it happens 4 times in a year, and PLAB 2 happens throughout the year. But
Okay.
the problem is it's difficult to get a slot. So
Okay.
the slots are limited, and like it's difficult to book a slot. And I gave my exam when there was COVID, and there was a huge
Mm.
backlog, and the backlog is still not like over yet. It's still like people are
Okay.
still
So
waiting
much.
for a long time now.
Yeah.
Yeah, so that's the only drawback of booking this exam. It sounds like it's great that the exam is 4 times, but it's difficult to book a slot for the exam. But hopefully
True.
you should be able to book it because everybody else does.
Okay.
Yeah.
True. So if you are like not able to clear in the first go, then you can just immediately attempt the second one or the third one, like the.
Yes, as soon as you get a slot, you can attempt this next one.
Okay.
So
Got it.
you
Got
have
it.
like four times, like you can attempt it 4 times.
Maximum 4 times. Okay. Ishmita, regarding the fee structure, like someone who is planning to move to UK and give, they have cleared suppose the part one and now they're going to give the OSCE. So what is the fee structure they should keep in mind before going, and like how much should be the budget in the mind, just for a like an idea?
Yeah. So if you're just going for the exam, like um I'm not talking about like the job and everything. If you're just
Yeah,
going for
yeah.
the exams, then firstly you need to clear an English exam that is called as OET or IELTS.
Okay,
So each of them, OET is a little bit costlier. It's around 33,000, and IELTS is
okay,
like 18,000. But IELTS is like more difficult to crack than OET. So I think people who want to
okay,
go for PLAB nowadays just goes for OET, and OET is around 33,000. Then you have the PLAB Part 1, which is
okay,
around 23,000. And then you have PLAB Part 2, which is around, I think, 850 pounds. That's around roughly 80,000. The
okay,
exam itself is 80,000. So, and I would suggest anybody going for the exam should go to UK at least a month prior so that you have
yeah,
enough time to um, practice with other people who are going for the same exam, because you need to do face-to-face practice with the people, and
true,
and also hands-on experience is required. So at least 1 week before the exam or 2 weeks before the exam, you should be using the mannequins and practicing on them. So yeah, for a 1 month stay with the exam would roughly cost around like 2 lakhs, 2 to 3 lakhs. But if you plan to stay longer
okay,
than that,
yeah,
if you plan to stay longer than, so usually the accommodation itself costs around 50,000, and then 50,000, another
okay,
50,000 for your eating, traveling
expenses,
and
yeah,
stuff, and then almost
true,
60-70,000 for your flights. And if you plan to stay longer, like do clinical attachment or things like that, then obviously that you'll have to have a budget for that as well. But roughly, I think to be safe, having 3 to 4 lakh in your bank account to show it to the visa people, it's
yeah,
sufficient.
okay, sufficient. And the visa also, like once you clear the part one, then only you can apply, or like how they give.
Yeah, usually you should apply once you have cleared part one. Otherwise, like you'll apply for visa and then you will, by any chance, if you don't clear the part one, then it will
And
go
then
for a
it's
very stupid.
yeah,
Or like if you want to, yeah, if you want to go to UK and do your PLAB part one, then that also you can do. But like, yeah, what's the point? Why do you want to waste?
yeah,
If you have money, you can go and do both parts there. But if
true,
you don't have money,
yeah,
like
yeah,
why you bother like going there? Yeah.
true, true. Okay, so how's the like now you have cleared part one and you are also have given one exam, and you are you said that you are in midway of clearing the complete course. So how you can choose this between the medicine allied or surgery, like how you choose that, uh, whether to go for surgical branch or the medical branch?
Yeah, to be honest, like I became a doctor just to become a surgeon. Yeah. So, yeah, when I was aspiring to become a doctor before I even joined med school, I always thought I'll be a surgeon and stuff like that. But when I started doing internship, like when I went to OT, the kind of happiness that would give me being in the operation theaters and stuff like was unimaginable for me. And I would always try to go to the
Spend,
theaters more than anything else. Yeah, so and hence I knew like I liked the work we do, and because we did not have postgraduates while we were doing our internship, we got to do a lot which usually people don't get. Like, yeah, and that made me realize that this is something which makes me happy, and that's what I want to do. And
okay,
but when I chose PLAB and when I went to UK, there were a lot of people, like a lot of my senior consultants, like people whom I knew, family friends, they were consultant in UK, and they told me that this is difficult,
yeah,
getting a surgical training as a IMG, it's difficult. Even like there are people whom I know who are born and brought up and they did their med school. Like it's difficult for them also to get a training number in surgery. But so yeah, so I am going to work towards that, and hence it will take a bit more time to create my portfolio, because they give a lot of point comes from portfolio. So
Okay.
your portfolio needs to be at par, and it needs to meet criterias like audits and then
Okay.
QIPs, and those are the things that you need to do. So these takes time. So hence, like, I'm trying to get my portfolio to
Yeah.
that level and
Okay.
finish the exams, so that I have a chance getting through. But
Got it.
if you want to go for IMT, or if you want to go for GP training, or if you want to go for
Yeah.
obs and gynae or any other specialty, like
Hmm.
each specialty has their own criterias, but some of them are relatively easier to get into, like GP, as for example, even if you're an IMG, if you do well in an
Okay.
exam called as MSRA. So
Okay.
that's the exam that you need to take if you want to go into GP training or radiology or obstetric and gynecology. And also, we from last year they introduced that even for surgical training you need to take this exam as well. So yeah, if you do well in that exam, you'll get through. And if you have like few the criteria for some of the
Yeah.
specialties are fewer than that of surgical training and radiology and stuff. So if you fulfill those criteria, you can start your training, like even if you go directly to UK, and you
Okay.
can start your training. But it's advisable that you at least like do 6 months as a non-trainee job,
Okay.
because that
Okay.
just to help
Will
understand
help
how
you build a
NHS
portfolio.
works,
Yeah.
and yeah, and
Okay.
build a
Yeah.
portfolio in the meantime. Because here we do a lot of
Got it.
things, but we never document that we have done these things.
True.
Yeah,
True.
so that's like, yeah, so that's something which they take into a lot of consideration, like what you have done and have you documented all of those things or not. Yeah, so I would recommend anybody going to work in UK should work as a non-trainee for at least like 6 months to a year, build your portfolio, then enter training. And as it is like training, training there is like quite long. So if I want
Okay.
to get into surgical training before I become a consultant,
Yeah.
it will be a total of 6 to 8 years. And
Okay.
yeah, so
So
you
that's
just
quite a
don't,
long time. Yeah.
yeah, yeah, it's a long time. So, how we have in our government system that uh, once you become a once you join training, you become a resident, then you become a
Yeah.
registrar, then you become a consultant. So that's how it works
True.
exactly. But
Okay.
here, doctors can practice privately as consultants, but there you have to become a consultant if you want to practice privately. So basically, it's
Okay.
just getting into training which matters, and then like you just leave the rest. You'll just keep climbing up the ladders.
Okay,
So
I
yeah.
got it. I got it. Now that's thank you so much for that clarity, because now people will know that it's not a like very. It looks attractive maybe from outside, but
Yeah.
it's not as easy as it is. And the reality is that it definitely takes time to become and achieve something. So, like, how's the working hours and how's the life balance there? Work life balance there?
So the best part about NHS is that you can't do 24-hour shift. You're not
Oh,
allowed to do.
like in India, you could do back
So
to back 3 days without sleep, sometimes 5 days also.
I know. That's like kind of the best part. So if you do 24 hours at a go, it's illegal. And yeah, but like that explains how like the working hours are. But I would say like it's more stricter, and it's more, even if you're working 12 hours, it feels like you're working 24 hours. Because talking about my department, work in trauma and orthopedics now. And
Okay,
we have a trauma meeting where you will have consultants from anesthesia, consultants from our department, and then all our colleagues, all our registrars. So everybody is there, and they will be discussing the cases that you have admitted overnight or you have admitted during the day, and you'll have to present and you'll have to tell what is the plan, and they will also then add on to what they think is should be the plan and all of that. So you need to be there by 7:45 sharp.
Okay. Okay.
The trauma meeting starts at 7:45, and then throughout the day, it's a very, very busy job. So you're constantly running, like how
Okay.
emergency in medicine feels, right?
True.
So
True. True.
you're yeah, so most days are like that. So you, even though your emergency is like uh for one 24-hour shift, it just leave you exhausted for like more than that, right? So
Yeah. Yeah. Yeah.
it's
True. True.
similar, like yeah. So in our case, like even if you're doing a 12-hour shift, it's very
It's almost
it's
exhausting like a
tiresome.
day. Yeah.
Yeah, yeah. But to be honest, like there are specialties which is easier, like psychiatry,
Okay.
GP. They are
Okay.
like lesser exhausting, but they do have like a lot of pressure as well. And the system is very different. You need to be very thorough, and you need to look after your patients very well, because and
Yeah.
like you can't
Always at the feet.
give yeah, you can't give excuses for your actions. Like you need to know what you're doing. So yeah, so
Yeah.
I feel
There
like
should be
that's
all
the same
yeah.
everywhere.
I got it. Yeah. Everything should be backed by science and like why you are doing that and why you're not, and that is very dealt seriously there. I got it. Okay.
Yeah, and also like if you're ortho, you need to know about the medicine part as well. Here, like or orthopedics, like
Yeah.
you can leave the medicine part for the medics to come and see. There, like even if you should know the
Yeah,
basic
it's easier to get,
medicine
yeah,
and
yeah, it's easier to approach doctors in India, I think, because like it's very easy to go and get a consultation from a gastroenterologist or a neurologist, and you can go easy. That's why I think here we refer cases like right and left, but I think in
yeah,
UK you cannot just do that because it is not so easy to
yeah, it's just like the system is very different. If you want to go to a different specialty, if
yeah.
I'm a patient and I'm currently admitted under ortho, but if my concern about my something related to my body is
Yeah,
acute, then the orthopedics will contact the
the medicine people,
specific
yeah.
team
Yeah,
to come,
specific team. Oh,
yeah, medicine or
uh,
whichever team is
whichever, yeah,
involved, like they will
yeah,
come
yeah.
and contact, yeah. But if my problem is not acute, like if I'm having some kind of back pain or something which is not
Which is not,
orthopedic, or
yeah, yeah,
some
yeah,
problem, yeah, some neurological problem, and that is not acute, then I'll
yeah.
have to go back to my GP, and they will refer me to my
Okay,
urologist.
yeah.
So the waiting time is a bit, yeah,
Got it.
it's
I think
bad, to
that's
be
how,
honest.
yeah, yeah, that's how it works everywhere. I think in America also, in UK and most of the countries. But I think in India, we are lucky as people that although most people don't know about this, that they think that they think it's very easy. But if we compare it with the other countries outside, so I think
Yeah,
in India we are very lucky that we can approach easily. Yeah, it is very easy. It
yeah.
is true.
Just saying, we have access to medication over the counter, which is
Yeah,
not the scenario in
then UK.
UK and US. Like, yeah.
True.
So you can't, like, you need to get a prescription if you want any kind of medication. Yeah,
Okay.
there are pros and cons to each of them, but
Definitely,
I don't
definitely,
know.
yeah.
Yeah.
So, tell me about your friends. Like, how, where are they from? Like, different countries, I think, and how many, like, Indians? How many you have got there?
Well, to be honest, there are a lot of Indians,
Okay,
as uh, yeah, you should be, like, UK is filled with a
full.
lot of Indians,
Yeah, a
to be
lot
honest.
of.
But I live in London, so
Okay.
London is like a place where people from every other country lives there. Like you have
Yeah.
very diverse environment there. The working environment, the kind of people are very, very, like you have people from everywhere, every part of the world, basically. So yeah, but
Okay.
the working environment is very supportive. You can approach a
That's really nice.
consultant. You can tell him, like, if he's saying something, he will ask you, do you think this is right? And if you feel that that is not right, you can always tell him his opinion. And like, they are very helpful. They will teach you
Got it.
whatever you don't know. And obviously, like, some I can't say that like everybody is like that, but majority is like that. If something is bothering you, you can always raise concerns. You can always approach the managers, the achievements of NHS, if I can say that. But yeah,
Yeah.
it's really, really good. Yeah. And
So it's
sometimes
like,
you do have
yeah,
difficult bosses.
true,
Sorry.
true, true. Is it like Doctor House, which we see in the web series? Or like, I just don't know. Like,
No, no,
that is how
I
we are
haven't
shown.
watched Doctor House,
Okay,
to be
okay,
honest. I haven't
okay,
watched it. But
okay.
I believe like Doctor House knows how to solve everything
Yeah, yeah,
or
yeah.
something
He
like that.
solves every. Yeah, he solves everything, and the working environment is something like that. The juniors can discuss, and there's a good discussion around, and environment is really healthy. What it is showed in the web series. That's what. So I think,
Yeah, to be honest,
yeah,
yeah, environment is very healthy if you're a junior. So obviously, like, you can't like say to a consultant that no, you are wrong and stuff like that. But you can
yeah,
always tell him that no, like, can you explain to me what is this? How did you do this? What
got it.
like, you can also make suggestions, like even in the theater, like it
Yeah,
happened to me that my consultant was somebody who was of 60, 70, and he was like, do you think this fracture is
okay,
reduced, or do you have any idea like how should we do it? Then like I gave him an opinion and he did consider it. So it
okay.
is like,
Oh, that's really cool.
it is it yeah, it is like very nice environment to work in. But I don't know whether I'm just lucky that my bosses are this good, and I don't know whether it's the same scenario everywhere else. But from what I have gathered, it's like you might have difficult bosses sometimes. Just because you're a junior, you need to keep your mouth shut and keep listening to whatever everybody else is saying. That's not the scenario. And yeah, there are people, like, there are difficult people, there are difficult bosses, there are difficult registrars that you will come across, but I feel like it's still good. Like, you can,
Still
you
good to.
might feel
Okay.
sad and stuff, those, but overall it's a healthy environment to work in.
It's really nice to know that you are working in one of such a wonderful environment. Regarding the stipend and anything, like how do you get paid for your work? Like, how's the stipend or the salary there?
To be honest, currently doctors are on strike in UK because they want to pay rise. If you're a single person living abroad, living in UK with this salary, it's very good. But if you're a family, then it's better to have your partner work as well. So
Okay.
roughly at our level, you get paid about like 40,000 UK pounds yearly. That's like around 40 lakhs yearly. And
Oh, wow.
as you go, yeah, but you get charged for your tax like
Got it.
21% or 30% tax, and
Taxes
they
are high.
actually
Yeah.
deduct tax. Yeah. So
Okay.
uh and yeah, as you go higher, your salary increases. As a consultant, you can earn up to like 80,000 UK pounds to 100,000 UK pounds, and it might increase as well. More, it might be more than that as well. We don't know.
Okay.
And yeah, but again, you have your private, if you practice privately, you have your private earning as well. And what does most of the people in UK do is that they have a side business, so you
Okay.
earn from that as well. Yeah, it's like whatever you want to do, and however you want to earn. If you're happy with the job, if you're happy with whatever you get from your NHS salary, then good. If you want more, then you can practice more. And
That's
also,
okay.
yeah, so also one more thing I would add, like if we are doing out of hours, or if we are covering some shift which we are not supposed to cover, then we get paid extra for that as well. So if you do extra
Oh,
work, like Yeah, we are supposed to do 40 hours a week plus on-call hours.
Okay.
So that on-call hours is
Okay.
extra, 40 plus on-calls. And after that, if you still have time and if there is any vacancy available, you can always go and work and you will get paid extra. So
Oh,
yeah,
that's
so
really nice. So
money-wise, I feel
that is, yeah, money wise, yeah. So this is so good because in India, of course, you are overworked and underpaid. But I think there you are at least paid for what you're working, and it's really justified. So that is good.
But but it's very expensive to live in London or like
That
in
is true.
UK. So half of your money goes paying the rent. So yeah, but still you have, if you're living alone, then you have enough saving for
Yeah,
yourself.
as you said,
So
true.
money
So
wise,
how
it's,
much
I
you,
don't think it's
yeah, how much you miss India or your family here?
Oh, definitely. I miss India a lot. And the
Yeah.
best part is like my sister is also moving with me
Okay,
to
that's
London.
really nice.
Yeah, hence, yeah. So I
So that
don't
will
think it will be
cover,
too bad. And
yeah, that will cover most of the part, I think.
yeah, and my parents also will keep coming and going. So I
Okay.
think it should be.
Yeah. So lastly, like overall, how's the opportunity? Like if someone is watching you and wants to take PLAB as the option and go and make a career in UK. So what will be the last message or the final message you would like to give from your end? Like should they go for it, or like any message from your side to the future aspirants from India?
I would say if you feel this is the right thing for you, just go do it. Life is beautiful, and I feel like you should experience whatever you want to experience in life. Travel as much as possible, and yeah, just live the best life. And I would say like your everybody's journey is different. So even if you feel that you are 1 or 2 years late or anything, don't think about it because uh, when you go outside or like even in India, you will see a lot of people doing their journeys very differently. And also, from where I'm working, I see a lot of people doing a lot of different things. Like they do in between, they do like something else. Like they will do MBA or they will take a 1 year gap and they'll come back to medicine or they will take few years break from medicine. So everybody's journey is different. Do
True.
not worry. Like even if you are late, just do what
Yeah.
you feel is right for you. Yeah, and if any questions or anything, you can link my email down below. They can always
Sure.
email
Sure.
me or ask me for any help.
True. True. Thank you so much, Ishmita, for finding out time in your short vacation which you have come to India. And I think I'm really grateful that you have taken out some time for this conversation. I think it's gonna help many aspirants out there. And also, guys, if you have any doubt, you can comment down below, or you can even I'll put her social media handles and the email in the description. You can definitely contact her and clear more doubts from her, and she's really helpful, I know. And thank you, Ishmita, so much once again for having this
Thank
conversation.
you for inviting me. Thank you for giving me the opportunity to speak and let people know like how my journey was. And
Yeah.
also like any help anybody needs, please feel free to contact me. I'll try to help with as best as I can. Thank you.
Okay, thank you
Thank
so
you,
much.
Nishan.
Yes. Yeah.
Thank you.